Hello and welcome to Dr. B's channel. This channel was created for you and thank you for joining me. If this is your first time on this channel, I created this channel basically to prevent diseases and to promote healthy living. Many times we just don't know, and the idea is providing information so that you know. And for those who have always watched this channel, thank you for staying with me. I'm glad you're here with me. Today I want to talk about polycystic ovary syndrome, popularly called PCOS. PCOS is a condition in which the ovary has small sacs that are filled with fluid and immature eggs or poorly matured eggs. And that's where the name comes from. So there's an ovary quite all right. The ovary is stimulated by the follicular stimulating hormone quite all right. But there is hormonal imbalance created by excessive production of androgens in that particular person. We all need androgens, a normal amount of androgens, but in this situation, the amount is excessive, and that's why there's an hormonal imbalance. So the follicular stimulating hormone and the luteinizing hormone that will release the eggs at intervals in the normal reproductive cycle do not function that way in women with PCOS. Many times, PCOS does not come to light until a girl child attains puberty. And that's when the girl or the parent might get concerned that the periods are irregular. And when I say irregular, it can be very long, it can be very short, it can be very absent, literally no periods. So it can take any form of irregularity. That means is you cannot say, oh, my period is every 28 days or my period is every 30 days. You can't define the range of that particular cycle. Every normal cycle should have a range of 28 to about 35 days. But because this is so irregular, you can't even define a pattern with it. That is what I mean by irregular menstrual cycles. And of course, that leads to irregular periods. Because the normal reproductive cycle, when the ovary is stimulated, follicles develop, eggs develop, and after the development of the eggs are released travel into the fallopian tube. If the egg gets fertilized, then hormones start to work to line the uterus in preparation for a baby. But if the egg is not fertilized by a sperm, then the lining of the uterus is shed in what we call menstruation. So that is what happens every cycle in a normal reproductive cycle of a woman. But in this situation of PCOS, it is not happening that way. And that is why we have those irregular periods. Many times, the eggs are not released, even though the ovary was stimulated. So it's forming, each time there's a stimulation, is forming, those sacs that I described earlier, because it was supposed to be a potential egg, but it never really fully formed and so could not be released. The cause of PCOS is really not known. And it's just identified that many things come together from the word syndrome, means there are many entities happening at the same time. So in this particular women, apart from the irregular periods, they have difficulty losing weight. Many times they want to lose weight. It's just very hard for them to lose weight. And many times it is associated with some obesity. A lot of them also have excess hair growth. So there might be facial hair. It doesn't mean that every woman with facial hair has PCOS. But just like I said, it's a syndrome. And there are things that come together that when you see all of it together, then you know this is likely PCOS. There's usually also difficulty in getting pregnant. And that's sometimes the next phase where people present to the hospital. Remember, I said the first time might be during puberty. But some people, as long as the period comes, they really don't bother. But then when the woman now wants to get pregnant, it might be difficult for her to get pregnant. And that might be when the diagnosis might be made in the first place. But there is no cause for alarm, because even though there is PCOS, it can be managed. And women with PCOS can still get pregnant. There was one other thing that I didn't mention as part of the syndrome. They usually have glucose intolerance. So people with PCOS have a tendency to be diabetic later in life or to be pre-diabetic. And that is just information so that the person watches closely and can take care of their health. So with all of the things mentioned, if it's all occurring together in a woman, then the doctor can then make a diagnosis of PCOS. But don't self-diagnose, please. See a doctor, because sometimes we hear things and we get scared and you start to put things together and think you have a condition that you do not have. I remember just a quick joke way back in medical school when we were taught about the symptoms of heart failure. One of those days after class, I was going back to my room, and the same stairs I've climbed so many times in a day and so many weeks on end. Suddenly I climbed it and I started believing that I had heart failure. So I know sometimes when we hear things for the first time, it plays in our head and we start to put things together. No, like I said, it's never about fear. It's about information and helping to make the right decisions so that you are not deceived with, oh, you need to take this herb. That's what will make your period regular. And then something else comes along. Kidney damage, liver failure because of so many toxic things you're taking just to get your period to be regular, or because you don't see your period, they are giving you things to say, this will make you menstruate. It might just be PCOS. It is better you see a physician to deal with it. Please be seen by a doctor. Be reassured that it is a manageable condition, and women with PCOS do have babies. I hope with this episode you are well informed and you can share with women that might have talked to you about irregular periods or having some difficulty in getting pregnant. They can be helped once they see the right person. And until the next episode, stay well. Make the best choices concerning your health and live a good life. Bye-bye.